Hey guys, well, welcome back to my channel. My name is Dr. Najman Riaz. I'm a board-certified psychiatrist and an empowerment coach. I love to make videos on emotional and mental well-being. Now, we all know that as the winter approaches, we may experience what we call the winter blues, which is just this gloomy, sad feeling. We just want to kind of curl up in the bed early. We don't want to wake up in the morning. Now, that feeling is what we call winter blues. It's different than seasonal affective disorder. Winter blues is a feeling that usually lasts for maybe about a week or a few days, and as people adjust into their new routines, this feeling goes away. But then we have seasonal affective disorder, which is actually a psychiatric condition. So it's a form of depression which has a seasonal quality to it. The majority of seasonal affective disorder happens during the winter months. It can begin during late fall and will last until early spring. In some very rare cases, seasonal affective disorder can happen during spring or even summer months. If we don't treat it, what could happen? Well, if we don't treat it, it will lead to decreased productivity, difficulties at work, interpersonal relationships, or in very severe cases, a person with seasonal affective disorder can have thoughts of self-harm. That's why it's important that we recognize it early and we treat it in a timely manner. How common is seasonal affective disorder? Well, the incidence of seasonal affective disorder can range anywhere from 0.5 to 3% in the general population. Those who have an already existing depression have a 20% more chance of getting seasonal affective disorder. People who have an existing bipolar disorder can have a 25% chance of getting seasonal affective disorder. Usually the signs and symptoms are very similar to an episode of major depression. Now, why do we get seasonal affective disorder? Now, researchers don't exactly know what causes seasonal affective disorder, but there are a couple of theories. The most common theory is that there is a change in our body's internal clock system, or what we call circadian rhythm, meaning that during the wintertime, since we all know the days are shorter, so we have less amount of sunlight that we're exposed to. The sunlight directly affects production of two important chemicals in our body. One is the melatonin, and the other is the serotonin. Both of them sort of do reverse action. Melatonin is a chemical which usually slows our body down. It's the chemical which is released as soon as it becomes dark. So this tells our body or our mind that it's time to slow down and it's time to fall asleep. That's why many people take over-the-counter melatonin to help them fall asleep. So during wintertime, your body will make melatonin early and a little bit more than during the summertime. Second is serotonin. We all know that serotonin causes a sense of well-being. So during the wintertime, because sunlight is less, there is decreased production of serotonin, which can also lead to seasonal affective disorder. There's also some theory which believes that because sunlight is responsible in helping our bodies generate more vitamin D, so during wintertime, less sunlight means less vitamin D, and that can also be a contributing factor for seasonal affective disorder. So there's no one theory, but there are multiple other theories which can be responsible for causing seasonal affective disorder. Why do some people get seasonal affective disorders and others don't? There is definitely some genetic predisposition. So let's see what are some of the most common symptoms of having seasonal affective disorder. The first and foremost is sadness. Sad mood, present for more than 2 weeks. Changes in appetite, or either increase in appetite or decrease in appetite. Changes in energy, most likely you get fatigued or low energy, you can't concentrate, you have low motivation, you can either not sleep or you will sleep too much, you can develop anxiety. We could have feelings of worthlessness, helplessness, feelings of guilt. Your interests might decrease. Things you used to enjoy doing, you don't want to do that anymore. You want to isolate. In very rare cases, a person can also get thoughts of self-harm or suicidal thoughts. In that case, sometimes it can become an emergence. How do we treat seasonal affective disorder? Like depression, it's also one of the most treatable psychiatric conditions. And after proper and adequate treatment, a person can live a good and happy life and have a productive winter months. The most common treatments of seasonal affective disorders are psychotherapy and medications. In addition to the professional treatments, there are a lot of self-help strategies that we can do that not only will prevent us from having an episode of seasonal affective disorder, but it can also help us manage this episode if we do get one, and help us also come out of an episode a little bit faster. So let's talk about what are those techniques. So first and foremost, as soon as the winter comes, you can go ahead and move your work desk to that corner of your house where there's a lot of sunlight, maybe close to the foyer or to the window. Make sure your blinds are all pulled out of your room. In fact, if you want, just take those drapes off, take those blinds off, let the sunlight come. So more you're exposed to sunlight, less is the intensity and less is the chance for you to get seasonal affective disorder. Get as much of a sunlight as possible, meaning go out for walks during the day. Number second, exercise. Even if you don't have seasonal affective disorder, you must have witnessed as soon as you move those muscles, as soon as you move that body, your body will release those happy hormones, happy chemicals in form of serotonin, endorphins, and dopamine, and also oxytocin. So make sure that during the winter months, you either join a gym or then go out for a jog, go out for a run. If you can bike, then sure you can. And if you have exercise equipment inside your home, then feel free to use that, but set up a routine. It's important also to remember that when you do exercise, do consistent, vigorous exercise for at least about 30 minutes or even more, because that's when all of those happy hormones will be secreted by your body. So exercise, again, is very important. Number third, pay specific attention to your nutritional habits. Make sure that you're hydrated. Make sure you're eating frequent meals, smaller meals, of course. Stay away from junk food. Make sure that you're consuming foods which are rich in antioxidants and vitamin D. Stay away from junk food. Do incorporate some carbs in your meal. Complex carbohydrates are always helpful and important. Complex carbohydrates could be like whole grain bread, whole wheat pasta, brown rice, and stuff like that. And of course, consume vitamin D rich foods, for example, cheese, dairy, milk, yogurt, fish, legumes. Go get a vitamin D supplement, say for example, maybe at least about 2,000 international units of a vitamin D supplement from your grocery store. Do start consuming it maybe around early fall, late fall, and if you are someone who does have a deficiency of vitamin D, make sure you talk to your provider, to your doctor, because sometimes you may need an extra dose of vitamin D, which you will not be able to get in over-the-counter medication. So for that, you may need a prescription. So then sometimes your doctors might also prescribe you a light box if you do have an active seasonal affective disorder. And many of these light boxes are non-prescription. You can purchase them from Amazon. I have put a link to one of the light boxes, also not a very expensive light box. If it is, then please check in with your doctor and see if your insurance is willing to cover for that. You get this light box, ensure that it's at least about 10,000 lux units. Whatever light box you purchase on Amazon, it should say what the strength of that light is. And do use it at least 1 hour every morning, because timing is very vital, as the alerting and the mood enhancing effects of light are most potent when you wake up first thing in the morning. The light must be very direct on your eyes, and your eyes must be open. Yes, that's very important. One can find relief usually within 2 weeks of using this light box daily at the same time, consistently every day. The FDA, as I said, has not approved them, and that's why many insurances will not cover for it. But please talk to a provider, and there is a possibility maybe your insurance might cover for a light box. There are some specialized phototherapy options that some psychiatrists do in their offices or therapists do in their offices, but that's something you will have to check with your provider, okay? So remember, during winter time, we do tend to isolate. So making those healthy connections with people who you love, people who you really care about, your good friends, try to maintain those healthy connections, whether it's making a phone call or making sure that you meet with a friend for a dinner or for a coffee at the local store. So I think it's important important to kind of get out of your house and also to socialize and find ways to make those healthy connections. All research is showing that connections, this human connections with each other, is one of the major factors for causing that emotional well-being. So it's important that you stay connected with your friends and your family, whether it's through the phone, FaceTime, emails, texts. But the best is just an in-person, eye-to-eye contact, because it gives you that sense of belonging, a sense of well-being. And medically speaking or scientifically speaking, those healthy connections do lead to production of healthy hormones like oxytocin or endorphins. Try to stick to a routine, means try to wake up same time in the morning, try to sleep same time in the evening, during the nighttime, make your lights dim and pull those drapes when you're just getting ready to go to sleep. Prior to bedtime, please try to stay away from gadgets, cell phones, computers, TVs, loud noises. Put on some light music, do on some light meditation, and try to get a good night's rest. Because try to develop a hobby if you can, whether it's like maybe reading or playing a musical instrument, whether you like to journal, write down your feelings, or you're doing knitting, or whatever you enjoy. Do that during the winter time. Try to keep a mood journal, or a journal where you could just write down about your feelings, especially during the bedtime. It can really help your mind to stay calm and focused, and you can also get out those thoughts which are gloomy or which are not very pleasing. If you're living alone, consider getting a pet, maybe a cat or a dog, because a sense of companionship or a sense of responsibility can also lead to a sense of well-being and increase in contentment. Now remember, whenever you get a moment, you can, if you want, just drive around your local neighborhoods during the evening time, and you can enjoy those holiday lights. Now remember, if you have mild episode of seasonal affective disorder and some self-help strategies are helping, then that's all good. You're consistently getting sad, depressed, hopeless, helpless. It's affecting your sleep, affecting your appetite. You're getting irritable, you're getting angry. That is the time to actually reach out to your providers. You can just talk to your family doctor and say, this is how I'm feeling. And then that time you can always begin either with therapy, or you can also talk to a psychiatrist who will prescribe you medications. Most of the time, the medicines that we use for depression are the same medicines that are used for seasonal affective disorders. And many times a smaller dose of antidepressants can help you to overcome the episode of seasonal affective disorder. And as I said, therapy is also very, very helpful. Don't forget to subscribe so that you can receive more helpful videos on your emotional and mental well-being. Stay warm and stay safe.